good morning or good afternoon, depending on where you are, folks. And thank you, everyone, for joining us for today's webinar on managing the response to COVID-19 in British Columbia. I'm David Hamilton. I'm Esri Canada's Public Safety Industry Manager and your host for this webinar. I'm absolutely thrilled to have Gurdeep Singh, Jamie Galt, and Ben Arl here with us today. Gurdeep is the Portfolio Manager of Business Innovation and Emergency Response for GOBC. Ben works with Gurdeep and he's team lead. And we've got Jamie here, who's the Manager of Health Emergency Management for the Ministry of Health. They've got some great content here to present today, so let's get to it. So first, a bit of logistics. We're recording this webinar, so expect an email in the coming days with a link. Following the webinar today, you'll be directed to an exit survey. We kindly ask that you provide us your thoughts on what you've seen in the presentation. If you have any questions about the content we're presenting, please use the Q&A panel. Be sure to choose to ask all panelists and then type in your question in the box and click send. We have a very packed hour ahead of us, but please feel free to type your question at any time. We'll do our best to get to the questions at the end of the presentation. If your question has not been answered at the end, we will be following up with you ASAP following the webinar. So like I said, we have a packed session today. We'll be covering off how ArcGIS is providing the foundation for British Columbia's Common Operating Picture Portal. We'll talk about how the COP is enabling the province to understand the context of the pandemic and other emergency management challenges it faces. We'll then hit on the benefits of cross-government approach to integrating GIS during a crisis. Topics 4 and 5 are some related Esri Canada solutions that I'll be presenting. And lastly, number 6 there, I'll briefly talk about about Esri Canada's or Esri's disaster response program and related resources. So with that all said, I am going to pass the controls and the mic over to Gurdeep and Jamie and Ben, and they'll take it from here.
Thank you, David. Just checking if you can hear me.
Can hear you just fine. Thanks, Gurdeep.
Excellent. Thanks, David. Thanks for the introduction. Just briefly, my role is a portfolio manager for emergency management and business innovation with GOBC.
And I'm Ben Arl, the team lead for Business Innovation Emergency Response for GOBC in Victoria.
Yeah, hello, and this is Jamie Galt, and I'm an emergency manager at the Emergency Management Unit at the Ministry of Health. As well, with gratitude and respect, I would like to acknowledge that Gurdeep, Ben, and myself are speaking on the traditional territories of a diverse set of First Nation communities across the province of BC. And today I have the privilege of residing in Victoria, BC, which is the traditional homeland of the Algonquin people, which includes the Songhees and Esquimalt First Nations.
Thank you, Ben and Jamie. Thanks for territorial acknowledgement as well. I'd like to start off with a few words about GOBC. Who is GOBC and what do we do? GOBC is a provincial agency, and we are part of the Ministry of Forests, Lands, Natural Resource Operations, and Rural Development. We provide GIS services and base mapping information for all provincial ministries, including emergency management stakeholders, with Emergency Management BC, which is EMBC, as the lead agency. Today, we'll share our experience over the last few months, how we leverage GIS data, tools, business knowledge, and expertise to manage the response to COVID-19 in British Columbia. We'll take you on a brief journey of our situational awareness platform that we call British Columbia Emergency Management Common Operating Picture Portal. You have a screenshot from the COP on the left-hand side here. We'll also provide you some contextual information about leadership, strategy, and GIS governance. In the second half of the presentation, we'll do a deep dive into the products related to COVID-19 response. You see a few screenshots on the right-hand side. including some core elements of our strategy that includes collaboration, change management, innovation, data management, and our approach and best practices. I like to show this picture to talk about situational awareness needs of emergency management stakeholders. I took this picture during an agency or stakeholder briefing during the 2018 flood season at the Southwest Emergency Operations Center in Surrey. This is what a provincial regional emergency operations center or a pre-OC looks like during any event. During COVID-19 response, the picture would look slightly different. This is a great picture as it illustrates our collective needs for a common understanding of hazard, in this case, flood hazard. What are some of the questions these stakeholders have? When and where will the flooding occur? What are the water levels and volume? Which communities will be impacted, and what will be the extent of flooding? What actions do we need to take, and when do we need to take those actions? Now, what's the provincial approach to answer these questions related to situational awareness needs? Create one place or platform to access all mapping information to support situational awareness for provincial agencies and partners of EMBC. Here we see several examples of the maps and tools in the Common Operating Picture platform to support situational awareness needs of emergency management stakeholders. Now, when it comes to emergency management, we need to take an all-society approach as stakeholders have data, knowledge, and expertise to contribute. This is one of the guiding principles of modernization of emergency management in BC and is based on the Sendai framework. We have implemented this principle by providing access to the Common Operating Picture portal to all levels of government and other stakeholders in BC, as you see on the screen here. The COP portal is also a mechanism for ongoing collaboration with all emergency management stakeholders in the province to share data, knowledge, expertise, standards, and best practices. Now, in order to translate business need and opportunities into solutions for emergency management stakeholders, we also need a robust governance framework. GOBC and the province has invested in GIS governance framework over the last 2 decades to create a solid foundation to support any crisis in the province. For example, as part of our GIS business delivery model, we invest about 15% of resources in business innovation. Most importantly, we have an outstanding team at GOBC, regional GIS, and GIS staff across various ministries that work together in the province to support a provincial response. Now, I'd like to hand it over to Ben. He will give you a short overview of the COP portal.
Great. Thanks very much, Gurdeep. Yeah, I always like to preface my talks with a statement that, in no other time in history have humans had the knowledge and technology to save human lives as we do today. And this is exactly what drives us at GOBC. It has driven us to find, more innovative ways to work collaboratively with our stakeholders and partners and bring in multiple sources of validated information for full situational awareness for emergency management decision makers. And we've done exactly that in the COP. It's a one-stop shop for emergency GIS information and our primary mechanism to display real-time emergency response data. We're working with multiple ministries, local governments, and First Nations across the province. And we've taken a very agile approach to building the COP because we really value the feedback from our users to build an exceptional tool that's really just a powerhouse of data. So this is the COP. It's made up of multiple Esri components, including operations dashboards, web app builder, tab series templates, experience builder, cascade story maps, survey 123, Esri hub, insights, and business analyst pages. We've added all of these components together as building blocks to make the COP utilizing the entire Esri ecosystem. And everything is completely out of the box. I'm not a developer. I'm a cartographer. In fact, my family's been making maps since the 1700s. But using this system of apps within apps has made it really easy for our team to create these tools. So what you're seeing here is the landing page. It's where we put notices, news, training material, and contact information. And the first tab I'm going to talk about is the EM dashboard, or emergency management dashboard. Now, I'm a big fan of Hollywood disaster movies. And when the hero walks into the emergency operations center, there's always this giant map on the screen. Well, who makes that? What is it actually showing, and where are they getting their data? So that's what we've tried to do here. And this is the map that's shown on the big screen in emergency operations centers across the province. But the EM dashboard is where we provide essentially a snapshot of all the emergencies that are affecting the province. This includes the number of COVID-19 cases, flood notifications, drought information, wildfires, earthquakes, and tsunami warnings, as well as evacuation orders and alerts. Now, a lot of these data actually didn't exist before we created the COP. But as we continue to improve and develop it, we were able to work with our emergency management partners to identify a lot of gaps in our available data. And now all of these data sets are available publicly. The next tab is the situation awareness map. We built this using Web App Builder, and it gives users the ability to dive deeper into the emergency data. We have a number of provincial boundaries and data to show important context around the hazards that are impacting the province. It provides users with the ability to use a powerful geographic information system for themselves. And this is incredibly important during an emergency, as it alleviates the chain of GIS requests and gives users the tools to help them make their own informed decisions. As you move deeper into the COP, the maps and the dashboards and the applications become more specific to a particular emergency theme. So this includes floods, wildfires, earthquakes, droughts, health, and other resources, as well as our specific COP COVID-19 dashboards, and we'll speak to that a little bit later. So that's our brief introduction to the COP. And yeah, actually, I'd just like to pass things back over to Jamie.
Yeah, thanks, Ben, for giving that great foundation of what GOBC offers the emergency management community in the form of the common operating picture. I'm going to change gears slightly and now discuss COVID-19 and how it has impacted the province of BC and our emergency management response here at the Ministry of Health. I'm going to start the journey. To do that, I'm going to just lay the historical context, and so we can all start on the same page. So firstly, on the screen in front of you, our team has put together a quick high-level overview of the timeline and key events that our ministry has gone through. It's important to note, and I'm just going to highlight a few dates, that our team has been heavily involved very, very early on. So we've been involved since approximately right after Christmas, when our team returned from Christmas break, and a colleague of mine said, hey, there is this novel coronavirus happening in China. We need to pay attention. Quickly after that, and by January 20th, we were having our first meeting here in our office with the provincial health officer, Dr. Bonnie Henry. And coincidentally, at the same time, the BC Centre for Disease Control had already created a test that could be administered here within BC to test for COVID-19. Now remember, it's June now, and people have a hard time thinking that far back, but January is when this really started off. January 25th, the first case was reported in Canada. And quickly thereafter, on January 27th, the first case happened here in BC. And that really did sort of launch down the approach of our response and really how much more heavily we were included. Moving on to the next slide, this just shows how heavily involved sort of our main response time looked. So during the period of March 11th to the end of May, is really when the emergency management community and the province of BC as a whole really figured out that this COVID-19 was going to have huge impacts and ramifications. Prior to this, even the emergency management community didn't quite have a full understanding of what this was going to mean. Another few key dates that I'd ground us in is that on March 11th, the Health Emergency Coordination Center, what we call the HEC, was activated to a level 3. That is an all-ministry response, and essentially enables us to put more resources into the response. On March 17th, here in BC, a public health emergency was announced, and March 18th, that followed by provincial states of emergency. That followed a slew of provincial orders and declarations, that have been tracked in different means. But I think it was really just grounds that, this was the time that people started that the province responded. By April 25th, BC unfortunately reported 100 COVID fatalities. And by the end of May, look on the screen here, mid-May, the restart plan was announced, and we've actually sort of come out and we achieved that flattening of the curve. With May 28th, actually, our HEC standing down to a lower level of response. Now, obviously, this was not just a BC problem. This was an international response, and there was things happening all around the world. And us and our team were watching these developments. And one of the things that we certainly noted was the use of the Johns Hopkins case information dashboard and how they're using that very early on to track data and case numbers within first China and then all around the world. And me having an understanding of GOBC and what work they did, I thought, how great would it be to be able to provide this for potentially internal ministry uses, the emergency management community uses, and maybe even the public at large. So we really did have that in the background. Next, I do want to highlight a key component to the response here in British Columbia, and that's just the leadership component that has sort of been the guiding light for us. I don't think I really need to announce the person at the center of this picture, but for those that might be living under a rock or not aware of the BC situation, center is Dr. Bonnie Henry, the provincial health officer, who's led and been the guiding sort of light. However, importantly as well, in the right is Adrian Dix, the Minister of Health, who gave the direction to the health system. And I think importantly too, for leadership-wise in the emergency management context, I think Premier John Horgan, who stepped back and let the experts deal with the response. I think this is sort of a shining light and it has been an example of how to respond. I do want to give a bit of a background to the health system because I think it gives context for those that may be unaware of BC in its context. So the minister is responsible for leading the Ministry of Health and the health system at large. In BC, the health system has 5 regional health authorities. It has 1 provincial health services authority that maintains different agencies. It has a provincial scope mandate. And within the BC context, we have the First Nations Health Authority that uniquely provides health care to First Nations communities, both through federal and provincial support. All that to say is that this system, which costs more than $22 billion, employs 122,000 people, is very complex and is hard to organize and to pass and share data between it and how to organize and get together to make products work. It is very complicated and very confusing, and it is amplified during a time of crisis like we saw during COVID-19, and we currently still see during COVID-19. But how have we done in BC? So COVID-19 in BC, I think we fared by all measures fairly well. On the bottom left of your screen, you can see the June 4th technical briefing slide that does compare BC to other jurisdictions within Canada. We have, flattened the curve. Dr. Bonnie Henry will be the first to acknowledge that luck has certainly played a key role in flattening this curve. However, I do want to say that measures undertaken by Dr. Henry, specifically those measures that empower the citizens to undertake certain measures, helped us flatten that curve. In BC, we didn't actually employ a lot of the restrictive elements that other jurisdictions had. If you do a comparison of legal orders and legal tools that were employed, BC is actually quite less restrictive than other jurisdictions. However, we still were successful to do that. That curve was flattened by the legions of people that were working together, and I think this is sort of where our story goes, that we saw opportunities to work together in crisis and with different organizations like GOBC with Gurdeep and his team, and other organizations even within the health system, like the BC Center for Disease Control, which we developed their public case count dashboard, which we will get into much more detail. So that was a very, very quick snapshot of the BC health system and where we were and where we are today and where we're going forward. But I'll hand it over to Gurdeep to expand on some of the opportunities, seizing upon opportunities.
Thanks, Jamie. Now, Jamie provided great insights into the crisis timeline and leadership here in BC. The inspiration to see opportunities in everything, he mentioned that. I think this is specifically true during a crisis. During the COVID-19 crisis, we as GIS professionals saw opportunities everywhere, every day, and made the most of them with our emergency management partners and stakeholders. We reached out to our partners in health sector to offer help and assistance. Now, this proactive approach laid the foundation for collaboration, as Jamie mentioned, to develop several GIS products for COVID-19 response. As GIS professionals, we have the ability to play a key role in management of both natural and man-made events. We have the knowledge and expertise to leverage data and tools at our disposal to provide an understanding of incidents, trends, patterns, correlations in a geographic and temporal context. And I think this understanding is important to inform our response strategy for COVID-19. I'd like to hand it back to Jamie to talk about stakeholder requirements and collaboration.
Yeah, thanks, Gurdeep. Collaboration is key. And I've made the joke in our office in the midst of the March period of this response that it seemed like, I was in the middle of a Dr. Seuss book, and that there was all these different peoples, and they all providing different data sets and different types of information, and having different needs, and all getting confused and not speaking the same language, and trying to figure out our way in this world in the mess so that we can actually deliver what was needed to the right people at the right time was super challenging. And I kept referring over this picture I had in my head of Dr. Seuss and just all the different things, data sets and interactions that were occurring, and trying to make sense of it all. And I think it was a challenging order to do. So luckily, through inspiration, opportunity, and initiative, we did seek out those people that rose above the GOBC and Gurdeep and his team. People like Laura McDougall from the BC Centre for Disease Control, that sort of helped cut and navigate through this confusion. And really, what it sort of did boil down to is, two fundamental differing things. First, to sort this out, we needed to ask what questions do we want to have answered, and that was the first part of this. And then who do we need to work with to answer those questions? So GOBC and Gurdeep and his team, helped to clarify some of these roles and help to distill, what do we didn't need to tell people and how are we going to do that? I knew we needed to tell people information, but we needed to figure out how to do that. So we quickly landed on three different stakeholder groups. First, internal BC health system stakeholders that have much different needs than other folks. Second was the emergency management community writ large that had its own diverse set of requirements and were frequently asking for information. And the third, I think, in its own way, was the public, who was demanding information at the same time. So really parsing this out into these three groups helped us shape on what we were going to deliver and what we were going to tailor for whom and for what. One thing that we certainly landed on was case information and how we were going to describe that. So really, we did focus first on the emergency management community to provide them with information on cases within their jurisdictions at the health authority level. And then secondly, we built on that to build out a public dashboard product that gave that same type of information to the public at large. So I'll hand it back over to Gurdeep to describe how we leveraged Esri products to build dashboards to answer some of these questions. And I will first describe how we built the dashboard for the emergency management community for case information. And then later on, we will go into describe how we built out the public case count dashboard.
Yeah, thanks, Jamie. And I'd like to take you on a little bit of a journey and show you some examples, screenshots, how the BC COVID-19 and some of the other products evolved over time. We had to take into consideration various factors based on the stakeholder requirements that Jamie outlined. And that included the ability and willingness of various organizations to share data with the three stakeholders groups that you see on the screen, approvals to share data to public, data availability and data sources, and also the stakeholder needs as you see on the screen, plus the time frame for the data readiness to prepare and ingest and consume in the dashboards and the maps that we have. So as part of this journey, we built a coalition of various stakeholders from different ministries with various skill sets around an idea and common purpose. Having a few key champions like Jamie at Health Emergency Coordination Center in the beginning and Laura McDougall at BCCDC, as we continued on this journey, helped us as a team to transition from a dashboard using data from external sources like Johns Hopkins and World Health Organization to the current version of the BC COVID dashboard that has the health sector providing authoritative data to support and maintain it. So this is the first dashboard. To begin with, our team built this dashboard in late January, kind of early February timeframe, using the data from Johns Hopkins and World Health Organization. At that point, we only had 39 COVID cases in BC, very early days. As the cases grew, so did the need and desire to incorporate data from internal authoritative sources into the dashboard. This is where Jamie played a key role in providing us access to a BC COVID-19 daily situation report that we used to create a prototype with more detailed information based on internal data sources. In this dashboard, you see the case details on the left-hand side and also the demographic information and breakdown by health authorities. All along in this process, communication was the key element. Jamie and I were having 2 to 3 calls in a day and also on the weekends to figure out how to bring all stakeholders and get approvals to release the dashboard for emergency management stakeholders and public. Now, since we are all working remotely, we took the approach to draw our concepts using PowerPoint. This is an example to brainstorm ideas and track changes. And that was very useful. So finally, this is a version of the dashboard that was developed based on collaboration with Jamie's team at the Health Emergency Coordination Center and was finally made it available to the emergency management stakeholders in BC through the Common Operating Picture portal. So now, as you can imagine, once we reach this milestone and people have seen what we can do with the data to display and visualize information, Jamie initiated conversations with BC Center for Disease Control, and I let Jamie speak and share his thoughts on the collaboration and the public launch.
Yeah, thank you, Gurdeep. So at the same time, the BC Center for Disease Control had a willingness and initiative to create a more sophisticated representation of case dashboard, case information, and share it with the public at large. Prior to what we worked collaboratively to develop with them, they simply put case information in word text on a website. And we knew that we could do much better and give a much more representation across the province. And we really did build on the work that we had done with GOBC in developing the COP for the emergency management community and transitioned now to providing that same support to the BC Center for Disease Control and worked with them to develop the requirements for their public case dashboard. The one that you see currently on the screen was the one that published to the site. So we specifically worked very closely with the BC CDC just to develop what they needed to deliver to the public. This is different than what is needed to deliver to the emergency management community. I would like to highlight that this was certainly an iterative process, and this is one of the key approaches and maybe one of the benefits of using a platform like Esri, in that it was very easy for Ben and his team to go in and make changes on the fly, change icons, change the view, change the look and feel. It was not a huge investment of cost or time. So we could give different layouts and approaches and views for our partners at the BCCDC. So this also allowed us to build trust with an organization such as BCCDC that we might not have had common linkages before this, so that we could then roll out a product and have trust that it was going to be well adapted into the public sphere and it could be employed properly. So I will hand it over now to Ben, who will just quickly describe more of the elements and components of the dashboard in more detail.
Thanks, Jamie. So this is the version of the dashboard we see today. We've applied the BC CDC and health design elements. We've cleaned things up, and we've been able to add more data visualizations because we've had better data than previous versions. We are constantly updating the visualizations and indicators. For instance, we recently added to the total case breakdown by breaking into laboratory, diagnosed, and epi-linked, as well as of last night, our new international comparison charts. We have three main layers that are being ingested into the dashboard. This includes case counts, which are spatial, case details, and laboratory information. And each of these data sets are being updated and managed separately on a daily basis. So please feel free to head over to the BC CDC website and view the dashboard for yourself under data. You can also find links to the feature layers for the data that are available publicly. Next slide, please. So this is the COP version. We've tailored it specifically for emergency management professionals. It has a number of additional emergency management related layers to provide that really important context. And we actually also have a public mobile version, which is a really interesting story. Could we put the next slide, please? So this is our mobile version. And, you know, we'd always planned to make a mobile version, but as a phased approach for implementation. But the Friday night before the public release, we were done. All the revisions had been made, so I decided to show it to my wife. And like many of you on the call, my family and I were in isolation and at that point, and we're very interested in any information on numbers. So she said, "Oh yeah, it looks great. Let me just put it on my phone." And I said, "Well, it doesn't quite work on your phone." And she promptly said, "Nope, that doesn't work for me." And then began to tell me all the reasons why it needed to be available on a mobile device. So given the importance and the demands, I went ahead and created the mobile version that weekend. And part of the beauty of using Esri Experience Builder is that you can set which dashboard the user is directed to based on their screen resolution. So using one URL can direct all the users to either the desktop version or the mobile version of the dashboard, which solves so many problems for us. And my wife was really happy to see the mobile version. And, you know, now looking at the stats, 60% of the viewers of the dashboard are actually viewing the mobile version. So needless to say, I hear a lot of "I told you so's" since. So now I'm going to touch a little bit on the data pipeline. We took several new approaches to data and dashboard updating. So, you know, as we all know, the data is the key to a good dashboard, and more often than not, we do not get that perfect data set to visualize. You know, in this case, there were multiple data streams behind the scenes and multiple partners involved that all required control over their own data for quality assurance purposes. So we came up with some really innovative ways for them to update their own data. So first, we create a staging version of the dashboard and then a production version of the dashboard. These were essentially the same versions that did require updating twice. However, it gave us the ability to test out new visualizations and ideas in the staging version. The second thing we did was to create an update portal that you're seeing on the screen using Esri Experience Builder. And this brought all the various data update procedures into one place. This gave the BC CDC and the Ministry of Health the ability to control what they were seeing in the dashboard and really empowered them to have control over their own data. It also helped streamline the process as a whole, which made updating significantly faster. You can get, yeah, so here we've got a list of all the different update procedures, and it was really helpful. So that's it for me. Thanks very much, and back to you, Jamie.
Yeah, thanks, Ben. So I'm going to outline how we went about the public launch of this. And I think, you know, making something like this happen, it is a collaboration between multiple different organizations that all have different values and different requirements. And certainly what my requirements were here at the Ministry of Health were certainly different than what the requirements were at the BC Centre for Disease Control. You know, I did have that emergency management philosophy of like, don't be perfect, be the enemy of good enough, and had that need to deliver a product because I knew that the public wanted to hear this information and we were hearing it from multiple stakeholders. At the same time, the BC Centre for Disease Control was much more cautious in their approach. And they wanted to confirm that the data and the process were correct, and they needed to confirm that citizens would have trust in what we were putting up there. So we needed to balance those two competing demands. And I think that's important to realize that we did come to an agreement on how we're going to approach, and my approach would have created its own set of issues. And if we would have delayed potentially on a different approach longer, I was worried that the pandemic was going to be over before this was published. In the end, I believe we got this out in April 14th after the Easter long weekend. That was roughly about 3 or 4 weeks after we had already published the same sort of data set on the ENBC Common Operating Picture, but using a different set of, still using BC Centre for Disease Control data, but a different process to enter it. So the public version took a little bit longer to the public. So Gurdeep, you can, yeah, thank you. So on the left, you can quickly just see how it was presented before on the BC Centre for Disease Control. Case count and press statements was a simple, just updated text. And when we switch to the launch in the middle, you now see what is currently on the BC Centre for Disease Control platform and the dashboard there. Interestingly enough, at the same time when we launched, we also launched the data sharing, and that was a key reason for doing this, and it was a thing that certainly leadership wanted to have happen, was to have that data accessible to everyone out there, and we did not want to hold it back. I did get picked up quite significantly, and we had high use. So right off the bat, I think we had about 100,000 users. And you can see there on the screen that over time, we average about 50,000 users a day. And total, we've got over 2.5 million views on that. So certainly it is being employed across the province and beyond. And I think we're pretty proud at how people are consuming that data. And we've stopped being harassed by asking for this type of information in this format. Next, I will change gears slightly and just talk about other projects that we did work on, because I think it is important. And I think it's important just to say that success breeds success. So once one thing works, it's really easy to transition to something else. And that is the case. So this occurred when we had a requirement here in the province to provide collection center information on a map. When we transitioned collection center guidelines where testing was open to more citizens, we needed a way to quickly visualize that and map that. Due to our great working relationship that we fostered between GOBC, the BC CDC, we were able to put this product out in 24 hours. Using some of those processes that Ben has already described, it gives me the control to update any information on this map. And someone who's not technically so astute, I can do this in 5 minutes, and I do it on a regular basis when any of those information on the current, I think 83 or 84 collection centers changes. So that is critical in just the usability of me being able to make those changes without having to understand too much of the system. I will now just quickly hand it over to Gurdeep, who will describe some of the other products.
Thanks, Jamie. So I just want to highlight a few additional products that we created for emergency management stakeholders, and they are available through the Common Operating Picture portal. Also want to acknowledge that ESRI Canada developed several resources and templates for COVID-19, and you can see those all on their hub. We leverage some of these solutions here in BC to develop BC-specific solutions for emergency management stakeholders. This slide is about demographic profiles. They were very useful as they show key health and demographic indicators for a community and neighborhood. Initially, we developed a few demographic profiles with the support from ESRI Canada. Nathan Eng is one of our go-to person there, as it required use of new software extensions, that is Business Analyst for ArcGIS Online. We also set up a knowledge transfer between Nathan from ESRI Canada and our team, and now we have additional skills to develop these infographic profiles, not only to support emergency management, but also several other business areas. Our team actually ended up creating over 200 profiles for various communities across the province. And this is an example of one of the profiles from Vancouver. So these have been made available to all local governments and First Nations across the province. through the Common Operating Picture portal. The next one I was going to talk about is the Health Index Dashboard. This is another resource we were able to leverage through ESRI Canada. This dashboard uses community health survey data that we purchased through Environics to see where there are higher counts and percentages of those with existing medical conditions. Through this dashboard, we can see how many individuals might be suspected to have an existing condition. It's a great resource to understand the impacts of COVID-19, not only at a city level, but also at a neighborhood level, and the impact on various communities across the province. Having access to good data and analytics is critical in these uncertain times. So we did a few other products that we won't have time today to share, but this provided definitely an opportunity to explore some new ideas across the province. So this brings us to the end of the presentation. In conclusion, I would like to take this opportunity to share a few insights. I think you'll all agree every crisis presents an opportunity, and we double down our efforts to develop solutions to support COVID-19 response here in BC. We are very fortunate to have a dedicated team at GOBC along with regional GIS teams across the province. We also leverage partnerships with internal and external stakeholders to understand the needs of the communities across the province and provide GIS solutions that benefit both small and large communities. I think it's fair to say that in a short span of 4 to 6 weeks, we achieved several business and technical breakthroughs that will directly benefit other hazards like flood and wildfire response. Also want to acknowledge that due to the fluid and rapidly changing situation, the business needs, data sets, products, and services, they continue to evolve very quickly and rapidly. The crisis presented an opportunity to demonstrate the value of an agile approach to develop timely solutions. And I think it's fair to say that lessons learned will improve best practices to support other hazard management programs in BC. We have been also fortunate to be able to demonstrate the benefits of a cross-government approach to integrate GIS data tools and resources, as well as expertise during a crisis, as exemplified through some of the presentation from Jamie. This will really help us garner support for multi-jurisdictional and cross-ministry integration of data and tools to support emergency management in BC. I think looking ahead, this is a wonderful picture of Dr. Henry. The valuable lessons learned from the COVID-19 response highlights the need for continued investment in overarching strategic GIS framework to support all phases of emergency management. And as I mentioned early on in our presentation, we have taken a number of steps to move in that direction, but I think we'll continue to have more focus, more efforts put into that in place. And COVID-19 really highlighted that. So with that, I'll pass it on to Jamie to share his final thoughts before we hand it back to ESRI Canada.
Yeah, thanks for that, Gurdeep. I think you did a very excellent job summarizing over some of the key takeaways. I think for me, in reflecting on the process that we went through and seeing this as certainly a win on how we work together, I do compare it to other processes where, quite frankly, I did not have the wins that I needed. And then when I reflect on it, it wasn't actually due to the software, though that did make life easier. It wasn't due to any individual. It was more the approach and the willingness of the group of people that came together. And it was a time that required lots of effort and a willingness to get things done in a short amount of time. And that approach, that either agile approach and that iterative approach, and the willing to make mistakes potentially in the face of getting a product at the door to make an effect, was really the difference. And when I reflect on that, maybe the projects that didn't quite go the way that I wish they would have, that is the key cornerstone. So I do want to thank certainly the partners that we worked with on this product, GOBC, Gurdeep, Ben, and all the others that are behind the scenes, as well as BC Center for Disease Control. And I would highlight that Esri was a platform that we could employ and we could easily go at the gate, but it was with that mindset that enabled us to get things done. So with that, I do want to hand it back to David, and it's all yours. Thanks.
Excellent, guys. Thank you for that. You guys can hear me okay?
Yep.
Excellent. All right. That was just brilliant, guys. Thank you very much. Next, I'm going to take a few minutes to mention a couple of related solutions that Esri Canada is offering. First is the Emerging Management Operations Solution. Some of the maps and apps presented by Gurdeep and Jamie and Ben are actually part of this Emerging Management Operations Solution, or EMO, as we like to call it. So the EMO solution is available as a complete bundle that includes all the software, apps, content, and the professional services you need to get started. It's designed to help you really get up and running quickly with an integrated solution on really the most popular maps and apps for emergency management response operations that we find through our vast experience in emergency management situations, and I'll get into that in a little bit. But the potential applications for this EMO solution are many. It can be leveraged both for planned and unplanned events. For example, floods, wildfires, obviously disease outbreaks, oil spills, but also, like I said, the planned events such as parades and festivals and so on. ArcGIS online is at the heart of this complete and integrated solution, and enables your organization to collaborate and share via maps, apps, dashboards, and reports. The EMO provides strong capabilities around situational awareness, which is really critical, obviously, for emergency management response efforts. With that integrated real-time location-based solution, maintaining situational awareness makes it easy for you to monitor changing conditions as they happen, brief your team rapidly and immediately, and make better informed decisions that can really save lives and protect property. Situational awareness in the emergency management operations solution is enabled through several applications. First being the incident status dashboard that you see on the screen here, which can be used by emergency management personnel to monitor response activities and measure progress on incident objectives. Next, we have the operations response application, through which emergency management personnel can manage and understand the current status of emergency facilities and response teams. And then the last piece of situational awareness for the EMO is the incident briefing book, which can be used by emergency management personnel to brief stakeholders during an incident or an event. Next piece of the EMO solution is impact assessment. Understanding the impact of a disaster is really imperative to accurately assessing damage and deploying resources when and where they're needed most. With real-time actionable impact intelligence, you can quickly analyze the population, the demographic characteristics, the infrastructure, deploy teams, disaster response teams faster and more with more reliable intelligence. You can also conduct damage assessments as well. This is accomplished through, again, another series of applications. The first of which you're seeing on the screen is the impact analysis. The impact analysis can be used by emergency management personnel to really understand the impact of an incident on public and critical infrastructure and human populations. And Ben really touched on this really briefly, but he did a really good point earlier on putting the power of GIS into the hands of non-GIS users, and that's exactly what this application does. Additionally, for impact assessment, we also have a combination of a couple of apps through which damage assessment can be performed. First of all, by field inspectors to conduct structural damage assessments in either a connected or disconnected environment. And then users can also see those results and monitor them through a dashboard where they can see if damage costs exceed specific thresholds, for example. The last part of the EMO solution is all about public information. So really, citizens need access to information before, during, and after an incident to assess their personal risk and obviously determine when to act to keep themselves safe. Our public information app puts your information in the context of location, such as where hazards exist, what areas are under evacuation order, and perhaps where to go for help. The other solution I want to quickly cover is we term the coronavirus business continuity solution. So, or CBC for ease of use. So the CBC solution really allows you to monitor the status of your facilities, including the closures and other business impacts. It allows you to monitor the capacity of your workforce, including who is working from home or in the office or at another location. It also allows you to monitor the health of your employees, and that's only if your policies and your procedures permit you to do so. You can also use the coronavirus business continuity solution to understand and act on the current status of your workforce and facilities based on up-to-date information. And then last of all, with the coronavirus business continuity solution, you can communicate disruptions to customers and stakeholders so they know which offices or facilities or stores are open at any given time. Next, I'm just going to talk about a couple of resources. First of all, the Disaster Response Program, or DRP for short. The DRP assists with disasters worldwide as part of Esri's corporate citizenship. We support response and relief efforts with GIS technology and expertise when our client's capacity is exceeded. When you need help quickly, Esri can provide data, software, configurable applications, and technical support for your emergency GIS operations. All you do is request assistance via the Request Assistance button at the top right of the program's landing page, or by emailing disaster_help@esri.com. In both cases, it's really important and makes things go a lot faster if you use or have your Esri customer number handy as well in that process. And I really can't emphasize enough the power of this program. It's been leveraged. The program's been going on for 26 plus years, and really Esri has been a part of some majorly significant incidents worldwide. And I've highlighted a few here that are specific to Canada. And this is where I went back. If I go back a couple slides, and I said, it's important to understand the disaster response program and how it is applied to what I'm talking about with the emergency management operations solution. It's through all of this experience that Esri has gained an insight that the EMO solution has been developed. And it wasn't developed on a whim. It's all the events that Esri has responded to. They've gained that experience and understanding of how to deal with emergency management situations, leveraging GIS, the power of GIS. So, like I said, this is a small sampling of the incidents that Esri's responded to in the past 26 years. And when I mean small, I really mean small. So, in 2018, Esri received over 500 requests for assistance in that 1 year. But that's actually nothing compared to actually 2020. So far in 2020, Esri has received close to, if not over, 5,000 requests for assistance worldwide through the disaster response program. So they've gained a lot of experience in helping our clients deal with emergency management situations leveraging GIS, and that's again why the EMO solution was created. So additional resources that beyond the DRP, I've got a few listed here. We've got a landing page for the EMO solution, some resources for emergency management and COVID-19 response, the landing page for the coronavirus business continuity solution, and then last but not least, there's a story map on GOBC and how they've leveraged with EMBC the GIS for emergency management. Tomorrow, there's another Esri Canada webinar that we're hosting. This one is on optimizing your safe return to office. The key points presented will be map your floor space to ensure social distancing, monitor and track staff and guests in the offices, and then share information to provide staff with peace of mind. So be sure to look that one up and register. So in summary for this webinar, there was a lot presented, and I thank you for your attention, but you learned about how BC's Common Operating Picture Portal is powered and leveraging ArcGIS, how that COP is leveraged for the pandemic and other emergency management challenges. We also talked about BC's cross-government approach to integrating GIS during a crisis. I briefly mentioned those two very powerful solutions from Measure Canada, both the Emergency Management Operations Solution and the Coronavirus Business Continuity Solution. And lastly, the resources, including the Disaster Response Program. Again, I want to thank Gurdeep, Jamie, and Ben. They did an absolutely phenomenal job. You guys have done some amazing work for the province of British Columbia. And as a British Columbia person myself, I can't thank you enough for that. And for those of you in the audience, thank you for taking the time out of your day and participating in this webinar. Again, we'll email you the recording and a PDF version of the slides as well. And we'd also, like I said, like to get your thoughts on the presentation. So please fill out the survey, and that comes up after you exit the webinar. We'll now formally stop the presentation, but we'll take your questions at this time. Design / delivery for new releases of what you guys have done for the province. Who can comment on that one?
Well, it was quite an iterative process, as I mentioned early on. We started with a simple dashboard at the beginning without John Hopkins data and with John Hopkins data, and then as we started working with Jamie and his team in early to mid-March, we started ingesting the data from Health Coordination Center, the daily situation reports. It was quite a iterative process, and we were meeting almost on a daily basis until we were ready to launch the public version. So I think it was all hands on deck in terms of effort from BCCDC, Health Emergency Coordination Center, and the various program units within those. On the technical side, it was, Ben is the primary architect in terms of the solution. He has the technical expertise, and we have a team of 4 staff and several regional staff, but I would say there was, at any given time, we had 2 or 3 people working pretty much full time to support all the various elements behind the scenes with Ben in the lead. Ben, do you want to add anything?
No, that's right. Thank you, Gurdeep.
Okay, thank you, gentlemen. Next question, and a little bit contentious, maybe. There has been discussions. I've heard of this before. So one of the audience members is asking, I'm wondering if consideration was made to geocode COVID cases. That could make it more flexible for digging down the data by municipality, school district, or even neighborhood level, and make it easier to build accurate heat maps for focusing resources.
That'll be a Jamie question.
Yeah, I was just unmuting it. I think that is the perennial question out there, and I think we all recognize that need, that there is a need and there's a want for that, and I think that is balancing with the public health community, in a way ensuring that the data stays anonymized, that there is no re-identification, and there's no stigmatization of areas or regions that may have a case. So realistically, our marching orders came from the top. It came from Dr. Bonnie Henry, and her direction was very clear that this information would be released at the health authority level, so those 5 regional areas. We have released, even as of the June 4th technical briefing, it was released down to health service delivery areas. So that is a geographical breakdown to, I believe, about 18. So you would have seen in that technical brief a slighter breakdown of cases. But going below that, even, and it escapes me the GIS term that the health system uses for even a smaller breakdown of that. But no, do we have that information? Certainly. But that information is very tightly controlled by the public health community. We do not see it, and it actually does go into how we've developed this process. And it is the interesting thing. We do run up to things like FOIPA, so in BC, the legislation that protects privacy and information. So we understand the need. I think there is a willingness, and we want to balance that with the law and the ability and the public health professionals saying, is it a requirement or not? And I would say we certainly, even when we start talking about the intersection of COVID and other hazards, we are wandering up. We are probably through our flood season now in BC, thankfully, with minimal impacts, but we are now ramping to fire. And having the intersection of COVID into specific and wildfires into specific communities, there would certainly be benefit. But at this time, there's other processes that we've implemented within the health system to identify where those cases are and to ensure that we are adhering to privacy legislation and laws.
Brilliant. All right, that was a great question, though. It's paying attention to and understanding that desire to see the detailed data, but at the same time, from a public perspective, needing to keep it close to the chest, can be.
Yeah, and David, interesting enough, we've created our processes and the data. Maybe for the technicians out there, the data pipeline, how we have to build this and connect it is really interesting. As we do need to weave, it is a different approach than what we need to do generally with the emergency management community, even with the data, and I'd say even with the case information. We are given information prior to its release, and even though it is about to be public, it is still in a domain that needs to be confidential, because in the end, our leadership needs to deliver that in a manner that in a way that they want to deliver it. And I think we've seen the success of Dr. Henry and Minister Dix in taking that approach and being the key spokesperson. And I think BC sees it, but with that comes its challenges in dealing with the data.
Yeah, agreed. Thanks, Jamie. So are you planning to share your know-how to other government agencies? If so, how?
I can take that question. So on the technical side, absolutely, and also business side, we have Jamie. So this is one of the first presentations we are doing beyond our smaller teams within the BC government. So I think I personally think there is an opportunity for us in Canada, various jurisdictions, various organizations, to have like they call the term is hot wash, to look at debrief once we have some time and space to come together in a forum. You can certainly reach out to us. We can share. We'll be happy to share information with you one-on-one. But there may be also to look at how we can do something at a national level in terms of setting up a forum to have a Q&A, sharing experiences across jurisdiction, not only at the provincial scale, but also local governments. How did they deal with this situation? First Nations, and critical infrastructure owners. So there's so many stakeholders. Again, this has been an unprecedented situation, a crisis. So I think anything we can do to reflect on how things went, not only at a local level, but at a regional and national level, will go a long ways for us to deal with such events in the future.
Excellent. Thanks, Gurdeep. A few more questions here. Has EMBC or MOH explored the use of story maps for COVID for public audience?
Can start with this question. That's a great idea. I think the public launch, that was a big milestone. That has been placed for about 6 to 8 weeks now, I believe. A story map would be, if I understand correctly, a narrative. Some of the things, for example, what we shared with you. We haven't really, that has not been brought up, but we will discuss internally with Jamie and Laura McDougall from BCCDC if there's any interest and willingness to do. Again, it has to be led by the business area. We can make that suggestion, so we'll bring it up. Thanks for making that suggestion.
Yep, definitely. This one might be for Jamie. I'm not sure. What's the definition of a personal service? And that was from the timeline slide.
I don't have the definition in front of me, but personal service would be the barber shops, the massage parlors, and other services that are provided to that effect. So yeah, there was an order in BC. That was one of the orders that came pretty early to close those organizations, those types of businesses.
Perfect. Thank you, sir. Let me see a couple more questions here. Just wondering if you have a viewer account for anyone who is accessing the COP internally.
So, Common Operating Picture is internal, yes, for the stakeholders, primarily the provincial agencies, but also partner agencies, local governments, and First Nations, who have their presence in regional emergency operation centers when an event occurs, whether it is flood, fires, COVID-19. Currently, we have one account which we use, but I think there are discussions we are developing. We have initial thoughts in terms of how we can set up different roles and different access privileges. So if the person who's asked that question, if you want to discuss that further, please feel free to reach out, and we can share what you're doing or what you're trying to do and what we are envisioning.
Cool. I think we got time for one more. Data source for COP alerts. Is it a real-time feed, or is the data inputted manually in the dashboard?
I can speak to this one, Ben. It really depends on the data itself. So we do have multiple sources of data within the COP. The COVID comes right through when it is ready to go into the data. For other types of COP alerts, including orders and alerts and wildfires and flood notifications. Flood notification is actually a really interesting one. It used to be a spatial notification from the River Forecast Center, and as soon as that notification goes out, they also update through the same type of sort of update portals, the flood notification, and that comes up as a spatial representation. So I like to call things sort of more near real time because they are they come out as soon as the information becomes available. We do have some real time feeds, but again, we have so much data coming through the COP that it's always data dependent.
And Ben, maybe I'll just jump in there, and I think something that it's hard to articulate in the presentation, but just sort of we did touch on it very briefly, is how, for the COVID specific case information, we at the very beginning created a very unique way where I could control the input of the data whenever I needed to, and the use of a dynamic table. So I think that's not live, but as soon as I had access to it, I could change in the numbers. So part of our process was we had all of this information, but we had a business process to confirm numbers after Dr. Bonner Henry would give them, input them, and make sure that they are displaying correctly. So if there was discrepancies, if there were different case numbers presented, then we could on the fly change that. And we actually took out the middle person. So Ben and Gurdeep didn't need to be involved, and it was all us. And I could actually train that to any of my volunteers who don't normally work in here. They just needed to know how to log into a website and use a table, and then that updated the information where it needed to go. So that was a very unique solution, and so I think that has since evolved to much more complex once we've onboarded BC CDC and inputting their information directly. But it was certainly a unique and very great approach that we took.
Yeah, I think it's important to note that during these kind of times you don't want to try and start introducing new workflows or complex ways of doing things. You want to try and adapt what users are currently working and make it fit their workflows and go from there. So yeah. Definitely.
Yeah, and if I go back to that Dr. Seuss image in my head, David, and everybody that's listening, there isn't in BC, there isn't a magical computer system that takes case information from a site and moves it all the way into one repository and allows for certain people to have accesses. it's such a complex system where not one person understands all the different parts. So having to navigate that and understanding is really key. So, being able to be agile thinking and have a process that we could change on the fly and was simple was effective. So
Cool. All right. I think we've taken enough time from everybody. And gentlemen, thank you again. This has been a great presentation. I'm thrilled with what you guys have done. And thank you again for everybody participating in the audience. And be safe out there.
Thanks, David, for hosting us. Thanks, everyone.
thank you very much. Ciao.